Welcome everyone to our exciting journey to the world of microbiome control in medical centers. Today, we'll be diving deep into this tiny universe and to understand together how we keep this facility safe and clean for everyone. So, grab your lab coats and microscope and let's embark into this journey together.
Alright, hi guys, I'm Wei Jin. So I'm in charge of the topic surfaces contamination in the toilet of a hospital. And the possible germs and bacteria that can be found in the toilet could be fecal bacteria, for example, Escherichia coli, and we have Staphylococcus aureus, Streptococcus, Salmonella, Shigella, and many more. So now I will be taking you guys to the surfaces that possible to be contaminated with all of these bacteria.
Okay, so first we will be looking at the urinals and the toilet seats. So this area has the greatest concentration of the fecal bacteria, and it is also the most possible sources of infection. And next, the dry surfaces like the door handles in the cubicle and also the flush button would less likely to be contaminated, but we have to be careful also. The inside door handles and also the tap handles have a greater degree of contamination, as our wet hands will touch on it and create a moisture surfaces which allows the microorganism to survive under a more favorable environment. And these surfaces are often touched with wet hands after people having hand washing, and these will recontaminate their hands. Alright, so after looking at all of the areas that might be contaminated in the toilet, so now let's look into the mode of transmission.
First, it can be due to the splashing during defecation, and then through direct inhalation or ingestion, or a surface to hand to mouth transmission.
And that's the end of the surfaces contamination in the toilet of a hospital. So we have to be careful even after washing our hands. Thank you.
You are senior. The water came out from the tap is very dirty.
Yeah, I didn't realize it's dirty.
With this contaminated water, there's many bacteria that can be found inside.
Bacteria can be found anywhere.
Yes, you are right. There are millions of different types of bacteria lingering around in the plumbing system and pipe, but the majority of them are pretty much harmless. Unfortunately, there are some bacteria that are harmful and pathogenic because of water contamination and biofilm formation. If you are exposed to these harmful bacteria, it might lead to severe sickness and disease.
Really? So which bacteria are actually very harmful to us?
The most common one is Legionella, which will cause respiratory disease. In the worst case, it can cause death as well. The issue with Legionella bacteria is that it might not be completely removed with a drain cleaning service, and they hide in the biofilm. Do you remember E. coli and Staphylococcus that we learned in microbiology class?
Yes, I do. Why?
Both of these can also be found in the sink and in the pumping system. If you remember, E. coli can transmit foodborne illnesses and you will get pretty sick. If you ingest water containing Staphylococcus aureus, you could go into shock or it could cause a huge strain on your body. The last harmful bacteria that I knew was Salmonella, which can cause gastrointestinal illnesses.
Oh my god, I didn't know that. Is there any other way to avoid all this water contamination risk?
Yeah, of course. To prevent water contamination in medical center, rigorous monitoring and maintenance of water systems are crucial. If you found out that the tap water is dirty like just now, you we must immediately inform the medical center staff or hospital authorities about the water contamination so that they will take action.
I see. Thank you so much, Jessie.
Hi, my name is Ahmad Danish bin Ahmad Romel and I am in charge of the topic healthcare worker contamination. So, healthcare workers are EMTs, doctors, and nurses. They are usually found in hospitals or clinics, and contamination can be easily prevented if they follow the proper standard operating procedures. The proper SOP is to wear a mask, a lab coat or gown, and have hand sanitizer or proper hand hygiene at all times. As you can see from this video, the healthcare worker is giving a handshake to his friend. This is the perfect example of the dress code and SOP for healthcare workers. The healthcare worker's hands has already been sanitized. After the handshake, the healthcare worker has to sanitize it again to prevent contamination. So, examples of bacteria that can be found where healthcare workers reside in are E. coli, Staphylococcus aureus, and Pseudomonas aeruginosa. For E. coli, they are spread through fecal-oral transmission and contaminated food and water. For the Staphylococcus aureus, they are spread through direct contact, skin to skin, and for the Pseudomonas aeruginosa, they are spread through contaminated surfaces and equipment. Examples of viruses that can be found are COVID-19, influenza, and hepatitis. For COVID-19 and influenza, they are transmitted through respiratory droplets such as sneezes and coughs. And for hepatitis, there are 5 types. A and E are spread through contaminated food and direct contact with an infected person. B, C, and D are spread through bodily fluids or infected blood. Examples of fungi that can be found are the Candida species and the Aspergillus species. For the Candida species, they are transmitted through breastfeeding and items that are contaminated with saliva. For the Aspergillus species, they are transmitted through spores, and any person that walks near an Aspergillus fungi can be contaminated with their spores and be infected. And that is it for the microorganisms that can be found in a healthcare worker's environment.
Hello. Hello. Are you sick? Yeah, I am having bad flu. I got it from someone. So did you go to check out and or see the doctor? Not yet, but I just took number, so I'm gonna go and see soon. What's your number? My number? 126. Mine 127. I'm after you. is your disease spreadable? I think so, but so far no one has gotten it yet, hopefully. There's someone coming. Sorry.
It's my turn. I need to go check out now.
Sure. Bye-bye. Hi, doctor. Hello, patient. How are you? As from the record, I see that you are Jessie. So, Jessie, how are you feeling?
I think I'm having a very serious thing. I don't know what happened to me.
Did you recently got it?
Yeah,
Did you go anywhere for the past 1 week?
I don't know. But last week I did came here for medical checkup.
I see. Based on the previous scene, as you can see, there was a patient-to-patient bacterial transmission. So, just to summarize the scene, there was 2 patients, patient X and patient Y. Patient X was the one with the disease, and patient Y was the one without the disease. So, as you can see how patient X was coughing, and with all the saliva and the cough, those were transmitted to patient Y. And few days later, patient Y has received the same disease as patient X. So this is known as patient-to-patient bacterial infection. So there are around 5 principal modes,
by bacterial infection that can be transmitted, such as contact, airborne, droplets, vectors, and contaminated objects such as food, water, and so on. So when it comes to contact transmission, this includes direct skin to skin, or mucous membrane to mucous membrane contact, or even fecal oral transmission of intestinal bacteria. So the transfusion of these contaminated blood products also transmits several bacterial infections such as syphilis. Then when it comes to airborne, some bacteria are carried on air currents in droplet nuclei. For example, Q fever, tuberculosis, and Legionella. They travel in a great distance from their origin. Animals with Q fever have been known to transmit the infection to other animals as far as 10 miles away. Then when it comes to droplet, when an infection is spread via droplets, this type of spread is not considered as airborne, given that the droplets are likely to travel through the air far more than 1 meter. They are normally susceptible than airborne droplet to filtering in the nose via nasal hairs or to removal by nasal or facial mask. Then is vectors. Vectors, this is mainly like for arthropods like mosquito or ticks. It takes blood meal from an infected host, can be human or even animal, and it transfers the pathogens to an uninfected individual. Bacteria such as Shigella can adhere to the food pad of houseflies and be transmitted in this manner. While for vehicular, this includes food, water, or formite transmission. So this bacterial infection due to food and water, it develops when bacteria enters the intestine via the mouth. So those organisms that survive the low pH of the stomach, they are not swept away by the mucus of the small intestine as they adhere to the cell surface. And they may invade the host cells or release toxin and causing diarrhea.
Hey guys, now I'm gonna talk about paw and hand hygiene. One of the biggest issues in shared areas such as the medical center is that when proper hand washing techniques are not used, that cross-contamination can occur and germs can be left behind on items that the person in the shared space has previously touched. For example, if a person has not washed their hands and then proceeds to use a door handle, other people may then touch the same door handle, making their hand contaminated. Without noticing that their hand is contaminated, they then go on to touch their nose or mouth or other people, and it would be quite easy for infection to be transmitted to them. For example, in this video, me myself wash my hands without using the proper technique of hand washing. By washing your hand with only water, it does not wash away germs and only the small particles and dust that is washed away. To properly remove germs that is on our hand is by following these 5 steps, which are: number 1, wet your hands with clean running water. Turn off the tap and apply soap. Number 2, lather your hands by rubbing them together with the soap. Lather the back of your hands between your fingers and under your nails. Number 3, scrub your hands for at least 20 seconds. Number 4, rinse your hands well under clean running water. And lastly, number 5, dry your hands using a clean towel or an air dryer. You can also use hand sanitizer if soap and water is not available. The hand sanitizer must be alcohol-based that contains at least 60% of alcohol, and the sanitizer can quickly reduce the number of germs on hands in many situations. However, the sanitizer do not get rid of all types of germs. Hand sanitizer may not be as effective when hands are visibly dirty or greasy, and hand sanitizer might not remove harmful chemicals like pesticides from the hands. So, washing your hands properly is one of the most important things you can do to help prevent and control the spread of many illnesses. Good hand hygiene will reduce the risk of things like flu, food poisoning, and healthcare associated infections being passed from person to person.
In conclusion, addressing surface contamination, water contamination, healthcare worker contamination, and the other points mentioned previously are important that without prevent the transmission of infection, the entire healthcare system will not be able to perform its duties. So it is necessary for enhanced healthcare within the medical center and reduce the risks of infection, and also to enhance safety for both patients and medical staff. Mazen Wad with you, and thank you for your listening.